Well, good morning, good afternoon. I don't think good evening, but welcome to this policy webinar. My name is Ben Plumley. I'm a senior advisor to the Bay Area Global Health Alliance. I also have the privilege of being a consultant to Friends of the Global Fight, and I'm the host of a Shot in the Arm podcast. Well, this policy briefing is organized by the Bay Area Global Health Alliance, by our sister alliance, the Georgia Global Health Alliance. And we're absolutely delighted to have Chris Collins, who is the Chief Executive Officer of Friends of the Global Fight, a DC-based advocacy organization that is also a member of the Bay Area Global Health Alliance. So what I'll do is just hand over to Sarah Anderson, our Executive Director of the Bay Area Global Health Alliance, to say a few words of welcome, and then we'll get into it. Sarah, over to you.
Thanks so much, Ben. And thanks everyone for joining us for this briefing on the priorities of the Biden administration and the US Congress on global health. And I also want to say hats off and thanks to the Georgia Global Health Alliance for co-organizing and joining this call. For members of that alliance, welcome. This is our third policy briefing together and our second with Chris. So we're really happy to have Chris back with us. Just a little background about the Bay Area Global Health Alliance. The Alliance is a Bay Area global health community now with more than 55 members from across the sectors: academic institutions, NGOs, community-based organizations, and tech, biotech, and other private sector companies. We were really created to connect all of the amazing organizations working out here and in DC on different aspects of global health. And we're dedicated to building this community, working together, and leveraging and strengthening the Bay Area as a hub for innovation and to advance global health equity. We have two goals this morning. One is to get a sense from our guest, Chris Collins, who hails from the Bay Area, I must add that, and he's an Alliance member, on just what the priorities are in global health from the new Biden administration. This event is really very timely, as we have just had the World Health Assembly and the UN High-Level Forum on HIV/AIDS is just kicking off in New York. And we have a few days, the G7 will come together in the UK. Our second goal is to give members a good chance to ask Chris questions about these priorities, his work in DC, and how we, as the Bay Area Global Health Alliance members and the Georgia Global Health Alliance members, can support and learn more. And with that, let me hand it back over to Ben to introduce Chris and get the conversation going. Thanks again for coming.
Thanks so much, Sarah. And we'll dive right into the discussion in a second. We have the chat function available on this Zoom webinar meeting format for you to submit questions. Sarah, Madhavi, and I will moderate those and we'll bring those into the conversation after Chris and I have spoken for about 35 minutes. So with that, I'm absolutely thrilled to welcome our guest today, Chris Collins, Chief Executive Officer of Friends of the Global Fight. Friends of the Global Fight is a pretty unique organization based in DC with the goal of advocating for sustained and continued significant investment by the United States into global health, and with a particular focus on AIDS, TB, and malaria, increasingly COVID, the areas that are covered by the Global Fund, the international funding mechanism that's based out of Geneva. So, Chris, welcome. As you and I have worked together for, gosh, a good many years in different roles and different capacities, any one thing that really stands out to you as something that you would like to highlight in this policy briefing about your illustrious career so far?
I don't know if it's illustrious. I guess I would say that it's personal. I mean, I got into global health because, um, I came of age as 40 years ago as HIV was being discovered. And I spent a good deal of my youth being worried for the safety of my friends and for myself. And so the engagement in health and health equity is very personal for me. And I always tell young people when I'm talking to or just starting out on their careers to keep that personal connection and that passion for the work that really allows you to do your best work, I think. So that's the one thing I'd say about my career is it's personal. Lost you.
Ben, you're muted.
I got muted. So, Chris, the first area then to kick off, background to Friends of the Global Fight and the Global Fund against AIDS, TB, and malaria. Could you tell us a bit about Friends and what it does?
Friends of the Global Fight Against AIDS, TB, and Malaria was founded in 2004 by a group of people who were excited that the Global Fund was being created and wanted to secure longstanding U.S. support and leadership on Global Fund financing and Global Fund policy. And so they came together, formed the organization, and we've been in business since then. We're the leading organization with the primary focus on the Global Fund to fight AIDS, TB, and malaria, but we work very much in partnership with other disease groups that are focused on AIDS, TB, and malaria singularly, and also development and global health groups. We very much see our work as helping drive U.S. support for investment to end the epidemics of AIDS, TB, and malaria, but also tackle other pandemic threats around the world, and also to support human rights-based policy in those areas. So we're focused on the Global Fund, but we're very also working with advocates in support of the whole global health portfolio in Congress.
And could you just talk a bit about the relationship with the Global Fund and what the Global Fund does, and just how that has become a centerpiece of, I suppose, American global health policy over the last 20 years?
Sure. Well, the Global Fund has been around 20 years this year or next year, I guess. It is the largest funder of global health services in the world. It is the major international funder for both malaria and TB, and in the area of HIV, it's second only to PEPFAR in terms of financing. The Global Fund is very focused around results and demonstrating results. It's a partnership model, so it works with national governments, communities, and other donors to achieve its goals. That partnership over the life of the Global Fund has saved over 38 million lives and helped drive down mortality and infection in AIDS, TB, and malaria in every place that it works. So it's a unique model. It seeks to include civil society and decision-making at the board level, but also at the national level. It isn't funding directly to governments necessarily. Each country has to have a country coordinating mechanism, which brings together multiple stakeholders to make decisions about the country grant. Last thing I would say is, well, not quite last, we like to say that country ownership is in the DNA of the Global Fund, that it's really oriented around building country decision-making around how to address their own health needs. And I think that's one of the critical aspects to think about around the Global Fund going forward, that's obviously an increasingly important goal in global health. The other thing to think about is that the U.S. investment in the Global Fund works in synergy with our investments in the bilateral programs, PEPFAR, President's Malaria Initiative, the TB program at USAID. So they all work together. They have, the bilaterals have somewhat of a more top-down model, and that's working with the more country ownership model of the Global Fund. And there's a nice combination there of programming.
A nice combination. Other times of the week, I know other colleagues refer to it as a bit of a bun fight, trying to work out who's doing what where. But the great thing about the Global Fund is that it has, for almost the last 20 years, provided a very clear set of investment opportunities that are driven by countries around AIDS, TB, and malaria. And so that sort of gets us into COVID-19. And from the DC perspective, Chris, how much of a shift has COVID-19 caused, both to Friends' own advocacy, but the work of the Global Fund, but also the international development work of the US government?
Well, COVID, in many ways, it threw all the cards up in the air in terms of global health programming. I mean, it led to, of course, tragic direct consequences in low and middle income countries in terms of its direct impact with infection and mortality. The continued, lack of vaccine equity and equitable distribution of vaccines globally means that we're now seeing, two paths in the world around COVID, where richer countries are beginning to get it under control, and that's just absolutely not the case in many low and middle income countries. It's the other thing that's hard working in the Washington D.C. environment is, earlier in the pandemic, when countries needed so much support, it was hard to get Congress focused on the need to invest internationally in COVID because things were so bad in our own country. There kind of just wasn't the breathing room, I think, for Congress and the administration to think internationally, even though that's kind of absurd given that a pandemic is by nature global and we need to play a role in that. We're not safe until the whole world gets a handle on COVID. So, I think, but the other thing is COVID had incredible indirect impacts, which people weren't always recognizing. It's led to disruptions, serious disruptions in programming for AIDS, TB, and malaria. TB notifications, or in other words, diagnosis of having TB is down precipitously since the beginning of COVID, as is delivery of HIV prevention interventions. So one of the things that I think is going to be important for groups like Friends and all of us really is to keep looking at and talking about the knock-on effects of COVID, that it isn't just those direct impacts, it's many other impacts on health systems, but also on development and economics.
So before we get on to the Biden administration, perhaps a little bit of context about what happened last year. And I know we all have our own views about how the United States responded both domestically and internationally. But there were examples where the US did indeed lead on international COVID work. Could you talk a bit about those and what Friends' role was in helping continue to nurture that bipartisan interest?
Well, we spent, the second half of last year working with our partners, really, again, just laying out the case to Congress and to the administration, previous administration, that we need to be acting internationally, not just domestically when we think about a COVID response. And there were a lot of elements there, right? The Congress, again, the politics mitigated against investing internationally when things were so bad in our own country. You can understand that on a political level, not a practical public health level, but on a political level. And then people just weren't understanding how serious COVID was in Africa in other areas with low and middle income countries. There wasn't the appreciation of the knock-on impacts. Many policymakers were just hearing, oh, it's not so bad in Africa. It's not as bad as we anticipated. So for advocates like Friends, the whole second half of last year was talking about the moral and practical responsibility to invest and address this internationally, but also the knock-on effects on our disease investments and our disease fighting priorities, and the effects that this was having on development overall. The other piece was then trying to help people understand that if you do want to act internationally, absolutely you need to be investing in vaccines, but it isn't just about vaccines. You've got to have the personal protective equipment. You've got to have treatments, oxygen, rapid diagnostic tests. These are all urgent needs in low and middle income countries. And so that was a third component of our challenge last year, was to say, yes, vaccines, but it's not just that, it's also the public health investments that are needed. What happened by the end of the year, before the Biden administration came in, was that Congress did, well, first of all, the next COVID bill in the House started off with zero money for international. By October, they had revised. Speaker Pelosi, another Bay Area resident, had revised that bill, and the House passed the revised HEROES Act, which had $3.5 billion for the Global Fund and also for Gavi. That was great. The way it turned out at the end of the year in the smoke-filled rooms where that final deal on that bill was made was that Gavi got $4 billion. That was a direct result of leadership by Speaker Pelosi. So I'll leave it there because it picks up with the Biden administration.
Yeah, well, let's get into that. So Friends and its partners were absolutely instrumental in securing a major financial investment from the US, $3.5 billion into Biden's first COVID relief bill. And you're very modest about the role that Friends played in that. But can you talk about the sort of the momentum that went into that? This was a priority not just around dealing with vaccine hesitancy and promoting vaccine acceptance, something that's very important to many of our members here in the Bay Area Global Health Alliance, but it was also around pushing the basics: oxygen, PPE, ventilators. So could you walk us through how you were able to mobilize around very significant support for the international COVID response with the Biden administration?
Well, we were working with Congress, and then once after the election, staffed at the with the transition team, really making the case that we needed to do something internationally. And of course, we started in a good place because the new president is an internationalist. She's someone who wanted to rebuild America's reputation globally. And, we pointed out this was one golden opportunity to do that. The Speaker Pelosi was essential in all of this, and I'm sure her advocacy with the new administration. She is the one who stuck her neck out, calling for a major investment globally in COVID as of September, October. And so when January came around, the incoming administration floated its plan for the American Rescue Act. And that that included $11 billion for global investment, which was wonderful to see. It was really, finally, we had, the wind at our backs in terms of getting the global investment. Now, we were a little disappointed. One thing that's kind of an interesting aside and tells you about the fraught politics of global health, even in the presence of a pandemic, was that when the Biden administration released its proposal for the American Rescue Plan, it had all the different sections of it, had a dollar amount next to it, except the international piece. That $11 billion wasn't noted in the original media release from the incoming administration. Rather, 3 hours later, I got a note from somebody working with the incoming administration saying, check that website again. And lo and behold, the 11 billion had been added to the press release after everybody had gone to it. So it was kind of another one of those in the dark of night, the funding that dare not speak its name, if you will, that they clearly were worried about the politics there, but bless them for putting in 11 billion. Now, we later got detail from the Biden administration about the proposed way they wanted to break out that 11 billion. And we were challenged by the fact that at that point, they were recommending less than 1.5 billion for the Global Fund. So we then mobilized with partners and with partners on the Hill, very much with Speaker Pelosi once again, to say, no, we need to bring that number up to the HEROES 2 number value of 3.5 billion. So we just, and then it was just working with partners, really laying out the case once again, a whole series of emails to the Hill with the latest data about how the effects were becoming more serious in Africa. And we were thrilled to see that in the final American Rescue Plan, it included 3.5 billion for the Global Fund. That was the biggest portion actually of the international segment of that bill and the largest appropriation ever to the Global Fund.
And you're very modest, Chris, in the way you're describing the way in which you worked with congressional leaders. You mobilized, I think, the entire global health movement based here in the States, and certainly, regular communications with Sarah, colleagues, and myself here in the Bay Area to push our Bay Area leaders. Besides Nancy Pelosi, are there any of our elected officials that stand out to you as strong supporters, and people that we should sort of keep an eye on and work with moving forward?
Yeah, well, of course, well, we all know, Speaker Pelosi is my favorite AIDS activist. So, and she always has been. I used to work for her, so, and I joined her staff to work on HIV. So she, you can't really overestimate the impact of the speaker and how important she is. But Congresswoman Lee, now Chairwoman Lee, chairs the subcommittee of appropriations in the House that funds global health and state foreign operations, they call it. And, as I'm sure everybody knows, Congresswoman Lee has long been a great domestic and global AIDS advocate and advocate for global health. I'm thrilled to see her in this role. I know she's just going to shine because she is just such a trailblazer in terms of talking about the need to invest equitably, but also have human rights-based policy. So very excited to see what Congresswoman Lee does with her chairwoman position. But so she's very important to work with, and she's very important to acknowledge and thank, frankly. But I think, other people you're seeing really step up, Congressman Barra is really positioning himself as a leader on international investment and global health investment. Actually, I would say on the other side of the aisle, Congressman McCall, has really spoken out for the need to invest globally. So I think there's a whole lot of people in the California delegation in the Bay Area who we can work with to promote global health investment.
So we're 5 months into the new administration. As you look into your tea leaves, what do you see about its priorities, its values? Are we seeing a return to the Obama approach after the last administration, or are we seeing a new Biden era emerging? What could you tell us about that?
Well, no, I think it's an incredibly interesting time. And I think the title of this discussion is it a change moment? And I mean, that's the question. Do we just do kind of a halfway job in addressing COVID and let it go on globally for years and years and years? Or do we come together as a world and help everybody drive down incidence and mortality from COVID, get it under control, and reshape our global health architecture and our global health approach? If we were talking 2 years ago, the overarching kind of framing thought in global health advocacy was the movement for universal health coverage. Another way of saying that is everybody deserves good primary care services and other health services. How do we get U.S. global health investments towards building strong primary care health systems for people all over the world? COVID came in and it's changed the conversation, but it actually could lead us to thinking about a more health systems approach to the way that we support global health financing. Critical to that is we can't have a zero-sum game. We've got to increase U.S. investment in global health, and we've got to get other donors to do that as well. And we also need to incentivize implementing countries to invest more in health. So, I think, are we at a change moment in terms of the level of global health investment? I don't know. That's one question. The other is, are we at a change moment in terms of rethinking the architecture here? And I think the Biden administration's interest in creating a financing, they put a lot of emphasis on needing a system, a rational system for pandemic preparedness and response going forward. They proposed a multilateral financing mechanism, and they're kind of the global leaders on making that proposal. So is that an opportunity to get new money into global health and to take more of a systems approach under the guise of pandemic preparedness and response, but also really investing in health systems through pandemic preparedness. Does all that play out in kind of a harmonic way where we come out of this safer as a world, increasing our investment in global health and investing in a more systematic, systems-oriented way to meet the multiple needs of people in health? You know, and to me, that's one of the, and do all of that without losing our ambition on AIDS, TB, and malaria. To me, that's the place to strive for. I don't know if it's doable. I mean, you know, on the financing side. So we've seen from the Biden administration, the budget came out, detailed budget came out a couple of weeks ago, calls for about $10 billion in global health. That's about an $800 million increase. That would be in the pandemic preparedness area. 800 million is not nearly enough. You know, the calls for new investment in pandemic preparedness have been in the multiple tens of billions, really, if you add all donors together. So, but I think if we consider the 800 million as a signal and a down payment, and hopefully new money would come from the United States, what's a multilateral financing mechanisms is set up, and FY23 would bring us more money in pandemic preparedness and investment, then I think that's a good signal. Many of us were disappointed to see overall flat funding for the major bilateral programs, PEPFAR included, PMI, President's Malaria Initiative. So that was a disappointment. We want to work with Congress to bring that amount up. Global Fund is flat funded, but that was our ask because it's the third year of the replenishment cycle. All of that said, on the financing side, there's reason to be concerned and to think about how do we push globally with other partners, because it have not seen a level of investment from other donors that one would like to see, both for the ACT Day, the constellation of organizations responding to COVID, or making big pledges in terms of pandemic preparedness going forward. So as we lead into a special World Health Assembly meeting in November to talk about a potential pandemic preparedness treaty and a financing mechanism, this is the time to be pressing donors around making big investments in pandemic preparedness. On the change in the architecture side, really fascinating time. And I don't know where it's going to come out. I think, again, that WHA meeting in November is a critical next step along the road. But I think for all of us, it is time to be weighing in with everybody we know about the kind of approach to global health we want to see the US taking down the road.
Well, a lot to unpack there, Chris, and would love to come on to various components of that in a short while. What do you see about the Biden administration's approach to partnerships? Partnerships is something that obviously the global health alliances in Georgia, in the Bay Area, have put a lot of effort into, something Friends also is deeply committed to. And I think if there's one thing we've seen through COVID, it's a flourishing of different approaches to the way in which different partners, whether they're nonprofit, whether they are private sector, have been able to contribute. And certainly you see it from out here. Some of our foundational heritage companies, new heritage companies, you might say, from Silicon Valley, whether it's Google or Facebook, and they are on the call with us today, that have made some really fascinating, different kinds of investments in the way we prepare for dealing with vaccine or vaccine hesitancy, COVID misinformation, how we bring tools to local communities to understand and educate and inform. These are things that perhaps 10 years ago, policy wonks like you and me in global health would never have dreamed of. I'm also thrilled to see that we have Georgia Arnold from Viacom CBS, and she's the executive director of the MTV Staying Alive Foundation. Again, utilizing YouTube videos to educate and inform young people across Africa about COVID. We would never have imagined this. So to what extent do you see the Biden administration being willing to embrace these novel approaches to partnerships, to find innovative ways of communicating and engaging with communities?
From what I see, they are open to the new ideas and want those. But I do think it's incumbent on all of us to take those great ideas and great examples to them, and seek partnerships with them and the relevant programs. I mean, I think in the whole area of data management, information systems, there's so much exciting potential in terms of advancing global health using data systems and data management, information technology. And, you know, I think, but we all need to, we kind of need forums where we can have discussions about what those things are and lay those ideas in front of big implementers like PEPFAR and President's Malaria Initiative and Global Fund. So I'm seeing a real openness to partnership, but I think it's important to be explicit about what those opportunities are, and just share more information about that. I can say I just was part of a group that did a series of interviews with countries around the world talking about the HIV platform, laboratory, the data systems, the community response, how that played a role in the COVID response and in building out global health more generally. And data systems in all the countries looked at, people talked about how the data system for HIV, how useful that was in broader health and all the ways they want to build it out. And I think that's one of the great opportunities actually in global health going forward in so many different ways.
So here we are, beginning of the week of the UN General Assembly special session, or I think it's just a high-level meeting, isn't it, on AIDS this week. You happen to be part of the US delegation, I believe, Chris, to that meeting. And I guess it's a bit of a double-edged sword. You get to be part of it, but you don't actually have to go in person. Maybe that's a good thing, actually. So what do you think, if anything, we should expect to come out of the UN high-level meeting that's kicking off in New York today?
Well, actually, one of the honors of being on the US delegation is you actually have less free speech, because during the time of the negotiations, you're not supposed to say anything contradicting the government. So I will not say anything contradicting my government. But actually, I have to say, we've, members of the delegation had a talk with members of the administration yesterday. And I'm so impressed with where our country has been leading in the negotiations for the political declaration. You know, it really, I mean, I worked at UNAIDS during the Obama administration, and I saw the role that the United States can play when it has leadership that's interested in human rights and equity. The United States plays an incredibly important international role in those debates, talking about key populations groups, the importance of equity and getting health services to marginalized people, women and girls equity. Those are things that with a human rights-based administration, America is one of the leaders. And that's true in the HLM negotiations this time around. Now, you know, what we get, I haven't read the final declaration yet, but it's tough and it's concerning because even though we now have leadership in the United States that wants to engage globally and advance equity, there's so many countries in the world that push back against that. And in the HIV area, push back against talking about the need to address the needs of marginalized people and women's equity and human rights in general. So, you know, and we know how absolutely essential that good policy and equitable policy is to good outcomes in HIV and to health generally. So I think, what's the HLM teaching us? I think it's teaching us once again that it's a messy process and a messy conversation. But as much as we need to think about our advocacy domestically, and we do, we really need to think about being global advocates too, and supporting partners in other countries to get their governments moving towards more of a human rights-based health investment.
Yeah, and I think with the high-level meeting, if there's one lesson I think AIDS can teach us, particularly in this age of pandemics, this age of post-COVID, it is that solutions that we think come through very rapidly don't necessarily stay around, aren't necessarily sustainable. You have to keep fighting and pressing the point, whether it's around the needs of marginalized populations, whether it's around the need to combat misinformation and engage communities and individuals who are at risk. And so then we go to the end of the week, Chris, and we have the G7 meeting taking place in Cornwall in the United Kingdom. It's Biden's first international trip. Anything we should, expect to come out of that meeting, or do you think we're all sort of burned out with international meetings and conferences?
From what I hear on the global health front, I'm not sure we're going to hear anything dramatic out of the G7, although I think that it may be an opportunity for folks to start in earnest, rev up the conversation about what do they want to think about in terms of a pandemic preparedness treaty? What do they want to think about in terms of a financing mechanism? My suspicion is that you may not see in their communique a whole lot of breaking news in the global health area. One certainly hopes they'll affirm commitment to global fund replenishment and other areas of health investment. I think the real deal is probably going to be that November World Health Assembly meeting. But this could be an important step along the road to that. One thing I wanted to throw in that I didn't mention before, but I meant to on the financing side, and this will be interesting in terms of G7, but then also what happens with WHA and a financing idea, is increasingly you're hearing folks like Gail Smith, who's been recruited temporarily from the One campaign to run the administration's global COVID work from the State Department. They're talking explicitly about funding pandemic preparedness, not through the year in, year out aid budget appropriations process, but rather more from a security point of view. And that's a very exciting prospect because we know, it may be a way to break open investment in global health in a very exciting way. And another one of those things I think we need to be encouraging the United States along, but also other funders. So, could some of this pandemic preparedness money that goes to build health systems in a holistic way, could that come from Department of Defense financing, which we all know is easier to get? So that's an exciting avenue. I'm hoping they're having that conversation at the G7.
There's a certain irony, though, isn't there? The meeting is taking place in the United Kingdom, and the country itself has made some surprising, if not very significant, cuts to donor aid. Does this indicate, do you think, a growing sense of donor fatigue? It's the UK for the moment. Could France be next? Is this impacting American policy in any way?
Well, the cuts to foreign assistance in the UK are incredibly concerning. I mean, really need to work with our partners in the UK to help turn that around. And, I hope that the Biden administration and others will speak up about how the UK needs to do its part here. I'm very much hoping this is not part of it. This is not a domino. I think there are some positive signs from France. There are some positive signs from Germany and Japan. We'll see where we get with the WHA discussion in November. Global Fund replenishment comes up in 2022, and we start our advocacy for that in the late summer and fall. Replenishment is one of those opportunities to get people back to the table thinking big. We've got to break the UK and others out of this resource scarcity way of looking at international assistance and instead realize we've been underinvesting in health and we've been underinvesting in pandemic preparedness, and we've got the results to show for it. And we need to turn that around. I think one thing to point out too is global fund replenishment. As I said, that is one of those big opportunities to get donors to rethink and get out of their, flat funding modes and pledge increases. To do that, I think we're going to need United States continued leadership on replenishment. We'd love to see the United States host Global Fund replenishment this time. President Obama hosted replenishment several years ago. That we'd love to see the administration make an early and large pledge to the Global Fund for replenishment. But what all that looks like also is dependent to some degree on other things that are happening now, these discussions about pandemic preparedness, where those pandemic preparedness investments go. How much is pandemic preparedness part of what the Global Fund will have on offer in its replenishment investment case? Those are all kind of things that are question marks in the air for the Global Fund board to be considering, and they're going to have a special meeting in July to talk more about their role in those areas. But all of that, there's just a confluence of things happening right now. Global Fund strategy, dialogues, WHA dialogues about financing mechanisms, replenishment coming. It's all kind of coming to a head.
Yeah. We're going to open up the floor to questions in just a second. So we have a few that have come through, I see, on the chat. So if there are others that folks would like to raise, please do so. Chris, coming back to this question of partnerships, many of the members of the Bay Area Global Health Alliance have been involved in the WHO working group on technology, and particularly how we can deal with COVID accuracy of information. And it's an arrangement that has worked remarkably well. Friends has its own private sector advisory council, and I wondered if you could talk a bit about that, what it involves. I note that we have Mike Steinberg from Chevron. Chevron is the co-chair of that advisory council. So, Mike, thank you so much for being here. But what does it do, and what can we do from the Bay Area to support your work?
Well, that's yes, it's true. We formed a private sector advisory council about 4 years ago when we realized that we absolutely needed to and weren't yet engaging the private sector in its incredible ability to do advocacy in Washington. We weren't fully engaging folks and showing them advocacy opportunities in Washington. And I really want to shout out to Mike with Chevron, but I also see Josephine Sakina with Vive is on the call as well. Chevron and Vive Healthcare are the two co-chairs of the Private Sector Advisory Council, and also supporters of Friends, and we deeply appreciate that support, so thank you. We've, over the years, the Private Sector Advisory Council has done great things in Washington, a whole series of sign-on letters, for example, seeking increase in U.S. contribution to the Global Fund at the replenishment. That was successful. A sign-on letter, a couple sign-on letters calling for U.S. investment in COVID globally and specifically for the Global Fund. That was, as you know, successful. We've done Hill lobby days, and we've had dialogues, a series of webinars talking about private sector engagement in global health. And we want to do more in that space. And Ben, thank you for helping us do that. But we want to do more in kind of drilling down. How can different sectors of the private sector contribute to global health? What can they learn from each other? So I think what's coming for us is continued work with the private sector advocacy advisory council on that critical advocacy function, but also kind of going more in depth about the private sector role in global health. I would say, replenishment, as I said, is coming, and so we'll be working with the group on that. We really welcome new members to the Private Sector Advisory Council. We have about 25 great companies right now. There's no obligation of membership other than you get an email from me about once a month with an update of what's going on in DC. And then also when there are opportunities to do advocacy, like a Hill lobby day or a sign-on letter or something else, we'll put that out there as an opportunity, and it's obviously up to each individual company whether to participate.
So we got a question coming in from one of our board members, Punima Mane, who you know very well, Chris.
Great to see
She
you.
is an alumni of the Global Fund and UNAIDS, I suppose somewhat like us. And Panima asks, well, great to hear your analysis, and it's somewhat reassuring. Well, that's great. With likely shifts due to upcoming elections, how should we worry about the continuation of the current approach of the US government? And that's a really key question, because Biden himself has said that folks, the traditional allies, are saying, well, this is great, Joe, that you're going back to the post-war compact approach. But what happens if you lose the election in 2024? How do we know that we have a new consistency or a return to normalcy, to borrow the phrase from American politics in the 1920s? So how would you answer, Panima?
Hi, Purnima. Well, things are always interesting in Washington, and you have to be ready for changes. You know, I agree that's something we ought to be thinking about. And of course, the first big political change could come with the midterm elections. It is possible we could see the House flip back to Republican. One thing I will say is global health is mercifully one of the few bipartisan areas left in DC, and that's something we absolutely have to nurture. You know, that's particularly true on the appropriations side when we're talking about spending money. We've seen people like Congressman Rogers on the House side, Senator Graham on the Senate side. These are real advocates for investment in global health and in the Global Fund and in our bilateral programs. So I think on the funding side, even if there's a flip in control in either the House or the Senate, there are many champions to work with on Republican and Democratic side. The timing could be interesting, though, because this is the time right now where we have an opportunity, I think, to think about changes in the architecture of global health. Will there be a pandemic preparedness financing mechanism? To what degree will current organizations like Gavi and the Global Fund, US bilaterals, CEPI, to what degree will they participate in that mechanism or be separate from it? And so those questions may play out before we have a change in politics in the United States. One way this might play out is a real leadership position for the Biden administration, bolstered by folks in his party on Capitol Hill, to get new financing into global health in there for FY22 and FY23. And then if we do have a change in control, then I think we'll be working from a larger base. The other thing is, can the Biden administration advance this idea, as I mentioned, of financing some of the pandemic preparedness pieces through security financing avenues like DoD? If we could, in the next year and a half, make some of those changes in architecture, funding flows, and sources of funding, I think that sets us up well to continue bipartisan financing of those built-out approaches.
So, Chris, we've got a question that's come in from Liz Creel from JSI. And she asks, with the push for decolonizing foreign assistance and interest in greater regionalization and localization of resources in global health, how do you anticipate donor funding, especially non-emergency humanitarian, adjusting to align with this? And in a sense, that's something the Global Fund has always been doing, as it's, you know, these are country priorities that it invests in. But do you see this as something that is a greater trend now towards this?
Absolutely, and very exciting trend. And think about how these things are converging. It's a really interesting time. Again, coming back to the title of today's discussion, you've got interest in pandemic preparedness and recognition we need to invest in that. You've got an interest in a realization that we need to be building health systems, and we're building on years of advocacy around universal health coverage. And you've got a decolonializing global health movement at the same time, which is saying more decisions, just about all decisions, need to be made by communities on the ground, and we need more diversity and inclusion in global health decision making. You know, one can imagine a harmonic convergence of those different forces to an architecture and investment approach to global health that is very much building stronger systems of health for people, that is more driven at the community level, but which keeps some of the best attributes of some of the donor-funded approaches to global health, including putting a premium on being results-oriented and tracking, having metrics to track outcomes from your investment, and insisting on inclusion of civil society and human rights-based programming in the approach. So, you know, I'm very excited about the decolonializing global health movement. And I think there are ways in which it can take and run with other things that are happening in global health around much more of a system, an awareness around needing to strengthen systems that can serve people's health needs every day, but also be ready to pivot and respond to new pandemic threats that may come in the future.
We had a question come in from Samara Misra, and this is one of the things I absolutely adore about the Bay Area Global Health Alliance. We sort of give each other career advice at every opportunity we can get. But Samara asks a really important question about, you know, they've got a master's in urban planning, and how could that be applied in the new era of pandemics responses? And I think in a way this goes to your broader question, your broader point about this sort of articulation of a more harmonized harmonics approach, and the role of different disciplines in becoming engaged in global health. It's something the AIDS movement was very involved in. But Chris, to what extent do you see, let's say, a remedicalization of pandemics responses versus this kind of multidisciplinary grassroots up approach?
It's a great question. And, you know, I know the book you should read if you haven't read it. I've actually, oh no, I have it at the office. Okay. It's called Plagues and the Paradox of Progress by Tom Beliki. And I can put that in the chat box in a minute. He wrote this book a couple years ago before COVID. He talks about this kind of thing that you're bringing up, is that we've been doing great things in global health, in investing in particular areas of global health, immunization, fighting AIDS, TB, malaria. That's wonderful. We need to keep those up, but we haven't made the investment in systems overall for health. We haven't made the same kinds of investments in employment and education for people in terms of our development approach. And we're seeing a rapid urbanization in many parts of the world, including many parts of Africa, where there aren't good health systems for people, but there's a lot more strain on the system and need because of the growing urban population. And so the need to think much more holistically about how we approach development. You know, and when, even before you got to your question, when you said what your training and background is, I thought of Tom Beliki's book, because it is about bringing together urban planning with education, with employment and health, and I would say the human rights pieces, the equality for women and girls, the addressing the needs of everybody, including marginalized folks. That is, we need to bring those disciplines together, and we need to figure out, you know, again, this is the big architecture question. What does U.S. international aid look like going forward as we have this more holistic, you know, this realization we need to be thinking not just about one disease and not just about health, but the connection of all of those things. We're not using our international assistance investment in a strategic way. I don't know that we've really even asked ourselves a question about how to use those resources strategically and in alliance. And I think there's a whole lot of room to do that. The question is, how does that dialogue happen? I don't really know. I mean, I think the game in town right now is to figure out what happens with the pandemic preparedness, financing and architecture, and global health. That's kind of the big vehicle. But I think the question you're raising is the bigger one, and the one we need, and climate too is all part of this, right? It's climate will be affecting health. Climate will be affecting the environment within these growing urban centers. So yeah, I mean, great that you're engaged, great that you're bringing new disciplines to the discussion. I think we've all got to figure out how to work much more holistically.
Well, Chris, we're coming up to the top of the hour. This has been a fascinating conversation, and we've had some really great questions. And thank you all very much for the engaged conversation. The closing question, Chris, I guess it would be, and of course, if there's anything that we've missed, please, please do tell us. But obviously, the WHO special meeting in November is something we need to be keeping our eyes out for. There's a lot happening in the way in which we think about global health. You've just spoken about the interdisciplinary approach. We spoke about the role of technology, of digital media and social platforms in changing the way we communicate and reach people. What are the things that you would like your friends in the Bay Area to be doing to support you? How can we at the Alliances continue to support you?
Well, we'd love to be in partnership with you. We absolutely want to continue with the Bay Area Global Health Alliance. That's been an exciting partnership. We will absolutely continue to do that with our Private Sector Advisory Council. Would love new members. If you're interested in that, please reach out. It really is true that you have in California, and particularly the Bay Area, some of the most important people who can move the needle on all the things we've been talking about. That includes Speaker Pelosi and Chairwoman Barbara Lee. First off, they need to thank you. They need to be acknowledged for what they've done already. The courage to do international financing in the midst of a terrible pandemic that had a terrible impact on our own country. That took a lot of leadership from them. So they need acknowledgement from all of us. And that's where it starts. Second of all, I think it is time to communicate with them and others, Congressman Ami Bera, others in the California delegation, about what you want. I mean, what does the opportunity of today mean for you in terms of global health investment? What are the changes in this potential change moment that you want to see happen? Right now, after you say thank you, is the time to be communicating to those lawmakers about the contours of global health investment from the United States that you want to see going forward, because we may not have this moment to rethink things for quite a while. We need to take advantage of it right now.
I think that is a very salient point for us to end on. We've got this, we called this session around the moment of change. Are we at a tipping point? And we may not have this moment for the longest time. Well, Chris, thank you very much. I'm going to hand back to Sarah Anderson, the Bay Area Global Health Alliance's Executive Director, to close us out. Sarah, over to you.
Thank you, Ben. And thank you, Chris, so much. This was so enlightening, and it really educated so many people in both the Bay Area Global Health Alliance and the Georgia Global Health Alliance. We so appreciate it. We have a recording of this, which we will share with everyone. And if you'd like to learn more about the alliances, about friends, just contact us. We'd be happy to help put those connections in place. We really hope all of you found this useful. And Chris, I loved what you said about the California delegation and the leadership and the opportunities we have here. And we're here to support you and your work, and to, of course, support global health. So I look forward to having another policy briefing, probably in the fall, and we can catch up again. And just thanks again to you, to Ben, to Maria at the Georgia Global Health Alliance, and to all of you for taking an hour out of your day to be here with us. This is the kind of conversations we like to have here. If you'd like to learn more, go visit our website, and thank you again.
Thank you.